Hello, my covey. Okay, so it is April 7th. I gotta read. April 7th, 2020 at around 7:17 p.m. So, uh, this is my update, I guess, if you can call it that. It's a war against COVID here in Los Angeles. So, how did my day at work go today? So, first of all, I hope you're doing well, and if you are, please remember to subscribe. So, what's going on in the world? We're still fighting COVID, this nasty enemy. I think there's some flattening of the curve in Italy. Fewer deaths. I think Japan is on lockdown. Read that New Zealand is doing really well. Sweden still not following the um, uh, lockdown like most Western countries. New York is sitting decreased death rate. Unfortunately, in LA, we're seeing an increase in the death rate. So I think it went up from like 149 to like 162 just in the LA area alone. COVID has affected over 1.3 million in the whole world, and I think we hit over 10,000 deaths in the United States combined. Um, so that's a lot of people. As far as the state goes, I think it's still the same. Still trying to procure ventilators. And wow, I haven't finished touching it. I've taken a shower and have eaten dinner, so I haven't gone anywhere. And even though I'm wearing the same shirt as I did yesterday, my hands are certainly clean. At least I hope. Um, the state is about the same. I think status quo. Los Angeles, since the weekend, they've announced that people should be staying out of grocery stores and pharmacy, and making it stricter because the next couple of weeks supposedly are going to be really bad. But the way it's looking, at least from my perspective, is that it's might be a slow. It might be dragged on because they're thinking about 14 days. We'll see a plateau, but I think that 14 days may be stretched a little longer. And I say that because I heard it too. It's not all of this is all my idea. There's about 1,400 critical care beds, and about 245 of those are critical care beds. Oh, did I say that right? Oh, there are about 1,400 critical care beds for COVID, and I think 245 of those are ICU beds. Yeah, I think that's what it is. So, and about 1,100 ventilators are available. So that's actually not bad, but still down 300. So I hear it's still pretty quiet in the other hospitals, but they're beginning to see some trickle in. Actually, so I'm getting from the news, the local source. It's from I think her name is Barbara Ferrer. She's the medical director for public health, and she's saying that there are more admissions. However, I talked to my coworkers who have relatives, friends who are working in other hospitals that they're also very slow. That they're not that they don't have as many patients admitted, but they do have COVID patients. So I guess we're just waiting for the onslaught of patients, the surge, so to speak. I also talked to police officers who were actually covering our clinic, who sometimes rotate to the main hospital, and they're saying that it looks like that hospital is actually sort of like a ghost town. So there's really not a lot of patients. So one of the officers got to talk to me. We got to talking for a few minutes. He was saying that when you go inside the hospital, you have a they have to wear N95 mask, but everywhere else it's just a regular surgical mask. So that's a that's a nice segue into the mask that I made that I showed last night. That I actually brought a couple to work. That's all I finished. There were a couple, and I showed it to a couple of nurses, and they actually said it's probably not a good idea to hand out to patients because they may have something, they may catch something, they may say, and it may open up liability like a lawsuit. So that kind of made me think, and so I think they may be right. So I think I can't really afford getting sued out of being kind, out of the things that I made. So I'm gonna hold off on holding masks. But I might make some for the family if they need some or if they want some. But I have a coworker supposedly who knew someone who actually bought $3,000 worth of N95 mask, and they're gonna donate it just for Sepulveda. Well, where I work, and so I told her I don't expect to get anything free, so I may buy some from her and go from there. So today, how did my day go today? I hope yours went well. I hope you're distancing. I hope you're washing your hands, covering your nose and your mouth when you cough, sneeze, and yawn. And also when you tell stories, probably not a bad idea to leave your mask on or to have a mask. As I mentioned, the last couple of days, I think, or the last couple of um, my live stream, that I was going to be in a screening today. It's pretty much like triage. So I actually wasn't really all that busy. But then again, if you were to look at how everybody else has done, this would have been a very busy 4 hours or 4.5 hours. So I did the COVID screening today, and I was there from 8 o'clock to like 12:30. Crazy thing is that I had seen two patients up until 12:25, and somebody walked in and says, "I have a cough." So we had to pull him over. So I ended up seeing three patients. So the first one was actually a patient that actually one of the doctors presented to me and said, "I have a patient." This is her telling me. She said, "I have a patient that I talked to. She has both of her parents are positive for COVID. They're very sick. She's taking care of them. She's now coming down with symptoms for a few days. She had mentioned that she was going to go ahead and treat this patient with medications. Pretty much, it sounded like a cold flu like symptoms. So she's going to go ahead and get medications for her symptoms, cough medicine, decongestant, the like." And she said that that she wanted to have the patient tested, and so she basically just turfed it to me. She dumped it, but she didn't even order the test. I went ahead and ordered the test. It was kind of like a bit comical, I think, initially, but it turned out fine. So excuse me. So this person, the patient, was supposed to show up at 9 o'clock. 9 o'clock came, and so I went outside uh, looking for the patient. Nobody was in the parking lot. There was a car that was parked, or a truck that was parked right in, right in front of our entrance. And I looked around. There was nobody there, so I went back inside. While prior to this happening, my RN, who actually I had to bail out 2 weeks ago, was kind of like really anxious, and she was just like chatterbox, like, and I'm thinking to myself, get the hell away from me. It's like, you're asking too many questions. Like, shut the hell up and just sit down. And I was like, do some work. It's just like, she's like, "Nyeh, nyeh, 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 nyeh." It's like, "Yeah, yeah, what's the name?" Like, she's asking me all these stupid questions that I didn't even know about. I said, "You know what? Just calm down. Just sit down." So, and I told her, and so the patient Uh, I told her that we had a patient coming in, that we needed to do the test. So another nurse who was actually a little calmer and has actually been swabbing patients before was actually there, and so they were occupied trying to do their things. So I called. So 9 o'clock came and went, and I said, "Where the heck is this patient?" So at 9:30, I called her. I said, "Hey, where are you? You're supposed to be here." She says, "You know what?" She said, "I went to Sepulveda." And she said, "I talked to someone." I said, "Wait a sec." I said, "I was out at 9 o'clock looking for you." She says, "Yeah." She says, I drove up there and then I talked to someone and someone told me that I should go to the hospital instead of this clinic." And I go, "Oh, okay." I said, "Where are you now?" She says, "Well, I'm lost." She says, "I want to go back to your clinic." I said, "Hey." I said, "Wait a sec." I said, because I heard her coughing between sentences, right? I said, "Why don't you?" Yeah, I said, "Since you're already there," I said, "Why don't you go? It's probably better that maybe you get checked. You might end up going to the emergency room." She says, "Excuse me." So she says, "I don't know where I'm at." She says, "I'm lost." I said, "You know what? Pull over, put your flashers on, your hazard lights on." And I said, "Tell me what's in front of you." And she says, "It's room," she says, "It's building 304." And I said, "Well, do you see anything?" She says, "Oh," she says, "There's a sign to emerge room 10." So she says, I said, "Well," she says, so I told her, I said, I said, if it was me, I'd probably go to that 10. And she says, I says, well, I says, "Okay, I'll try." So, so this is like around 9:30. So she calls me a few minutes later and she says, they will. I gave her my number. I said, "If you have any problem, just give me a call." So she calls back and she says, "They won't do it." I go, "What?" She says, "They won't test me." I go, well, why not?" And she says, "I'm just going back to where you guys are at." I said, "Okay, fine." I said, "We'll wait for you." So I told my nurse, and she was like, "Oh gosh," she says, "She knows she should have been there. She would have been better off there." I said, "Yeah, yeah, yeah. She's coming back." Yeah, she was still nervous. She's been nervous. She's been trying to avoid doing this shit. I just don't. I just didn't want to be blunt with her. So the patient calls back at around uh, 10 after no, is it? Yeah, 10 after 10. Was it? No, no, that was 10 after 10 that she talked. And so she actually got in at around 10:20. But before that, luckily, employee health was right next to us, and the employee health provider had to do 70 tests because one of the staff tested positive, and he had to test 70 people. I guess he did 40, but it got to the point where after 40 he just started having somebody else do it, and he just did the requisition. So he did that, and actually there was one staff who actually came in. He wanted to be he just wanted he worked in medical records, and he wanted to take his temperature, and they were going to bring him to me. I said, "Whoa, whoa, 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 whoa!" He says, "I just need my temperature taken." He says, "I don't need anything else." I said, "Whoa." I said, "If you're needing to have your temperature taken," I said, "Why?" I said, "If you're needing to get your temperature checked, you must be thinking that you have symptoms." He says, "Yeah, well, I have a cough too." And then they asked, "Well, do you work here?" Because I said, I guess they saw his badge, and then they said, "Well," and then they were trying to present it to me. I said, "You know what? If he's an employee, he needs to have his temperature check. He needs to go to employee health, which is right next door, right?" So he goes there and he gets tested on the spot. So while we're waiting for this patient to come in, my nurse and the other person kind of went over there and kind of observed how to do the nasal swab, and so that was fine. So they got a little bit of a little in service real quick. And then come 10:30, the patient's out there. She calls saying, "Hey, I'm here." I said, and she said, "I'm going to have my flashers on, my hazard lights." And I said, "Okay." So I went out there. I said, "All right, this is what's going to happen. We're going to go stick a couple of swabs in each nostril, and just try to relax. Don't move. If you're gonna sneeze, just turn your head the other way. And she says, okay. She had a mask on, and I was about what 10 feet away. And I said, I gave her an intro. I said, we're going to give you a sheet of paper of instructions. Your medications are going to be shipped to you. She says, yeah, they're coming in tomorrow by FedEx. I go, okay. So I said, if you get really very sick, go back to the emergency room. But I said somebody will be out right now. They're just getting the stuff. So then my nurse. So what's happening is that we have a teamlet. It consists of a clerk, an LVN, an RN, and myself, the provider. So we don't have a clerk. So it was just so it ended up being another RN. So my RN actually suited up. She had her bonnet on. She had her face shield. She had her mask on, and you could tell that she was nervous. She was just like, "Oh, she says, my glasses are fogging up," and blah blah blah. And she had the gown on, and she had gloves, and then I walked out with her, and another nurse who was actually the one with the gown was going to be the dirty, and then the clean one is the one with just the gloves and mask. I had gloves and mask. I was about 10 feet away. The other nurse was about 6 to 8 feet away. So my nurse, being short, being 4'11", she said, "Can I have you open the door?" Because this woman, the patient, was actually driving a Honda CRV, and my nurse is so short, she couldn't lean forward over the driver's side window, so she had to open the door, and so she could actually do the nasal swab. She had never done it before, but she actually, she did really well. She approached the patient and did a nasal swab and put the swab in the media, and then she was going to do the second one, and then she did that really well. But for some strange reason, when she picked up the vial, she dropped one of the swabs on the friggin' concrete on the asphalt cement, and she just said, "Oh, yeah." I said, "Yes." I said, "You're okay. You're fine." So the picture was got. She's her eyes, I guess, just like, oh, one of them like fell on the floor. It's like, well, how come nobody's like really panicking? And the patient's eyes were tearing up, and I guess uh, that happens when you hit when you hit the right spot. So my nurse just covers the specimen up, put it in a double bag, in a biohazard, and then we stepped away. I said, it's okay, just step away, just let it go. I said, give us a call if there's any problems. We'll call you in a couple of days, or we'll have the provider call you in a couple of days. So she drives off, and then my nurse picks up the trash because the nurse that's got the clean who's the clean nurse actually had the specimen in a double bag, and she went and sent it to laboratory, and then my nurse picked up whatever she left, and then I actually went back in and I sprayed the ground because I'm thinking they're saying, oh no, it's gonna be hot, it's gonna be asphalt, and it's gonna rain today, it's gonna get washed off. I said, hell no. I'm not taking any chance. So somebody had Lysol, I kind of and no advertising here. So I grabbed the kind of Lysol that smelled like lavender, but I could have sworn it smelled like some air freshener. So, it actually smelled like Raid, because I guess there's no advertising again. Is that Raid actually comes in lavender? So I actually sprayed the concrete, the asphalt with Lysol, lavender scented, and actually about an hour later it started raining really hard, and so got washed off, and it's pretty dark outside right now, and it just stopped raining. It had been raining really hard in LA. This is really freak weather. So you know so that's kind of like pretty much the first patient that I saw today. Was we did the swab. So I actually, like I said, I saw three patients for those 4.5 hours. One patient we swabbed, and two other patient. One actually, he actually they pulled him aside for me to do a secondary triage, and he says, I got bronchitis. He says, I've had this cough for years. I know, he says months. So I said, do you have any travel? He says no. And so actually, our triaging questions are changing all the time. So it used to be travel, contact with known COVID and symptoms, but now it's symptoms, known COVID, and diarrhea. Are you having diarrhea or are you having flu-like symptoms? So we're not even asking about the travel anymore. So that's kind of changed a little bit. And yeah, so this guy said he's got bronchitis. He's got chronic cough. He just came into the clinic because he had an appointment at 2:30 to have his eyes checked, and he said he just came in early because he wanted to know if he could be seen earlier. So that was him. So then the next one was a young guy. Is in his 20s, early 30s. He actually came in because he says he has asthma and he has a cough and he doesn't want it to develop into a fever, into a COVID. It's like, huh? Uh, I'm thinking to myself, you're kind of way off here, buddy. So he didn't need to be tested. And I told him, you know what? The only ones that actually, if you're very sick, go to your emergency room. If you're not that sick, go home and stay home and just self isolate. He says, yeah, okay. He says, I was just concerned that this cough may turn into fever and it might be COVID. I said, well, it's the same thing. If you have COVID and you have cough, we're not going to admit you. You know, right now the testing isn't there. We only had like 9 swabs left uh, this morning. So, usually, so we're still not testing that many patients, and pretty much it's still, if you have symptoms and you're not very sick, is to self isolate. And then, if you have any problems, obviously, if you're very sick, go to the emergency room, 911 if you have to. So this guy was very understanding. He says he didn't really need any medications. So one of the questions that the doctor who was going to relieve me kind of overheard this, because it was like 12:25 in the afternoon, and she was coming on at 12:30, and she was asking all these questions. Like, I'm thinking, huh? Why are you asking all these questions? And I guess what her thinking was, and she had talked to the pulmonary specialist, and she was kind of, I guess they're kind of getting annoyed with her because she keeps calling and she's asking all these questions. And I guess one of the either the fellows or the residents said, don't start any steroids if they have any asthma. Or if they have respiratory problems and they need steroids, you shouldn't start him on any. Or I said, well, I'm not starting him on any. I said he's been on it for a while, and she says, you know what? Yeah, she says I'll call the pulmonologist and see what they say. I said, are you sure? I mean, I could call him. She says, no, no, no. She says, you know, uh, she says I don't mind. She says I want to know too. She says so. So about an hour later, I guess she IMs me, and she does instant messaging, and she says, oh yeah, she says, this is a little bit different from what I was told last time by the other pulmonary fellow. And she says, so if you have chronic uh, asthma or COPD and you're on inhaled steroids or on oral steroids, just leave them on him. But if you have a COPD or have asthma who's got an acute attack or acute exacerbation and it's severe, she said that you might want to call the pulmonologist and get an opinion to see if you should put him on systemic steroids. And I said, well, what about inhaled steroids? And she says, yeah, you probably call the pulmonologist, because she had mentioned, well, don't put him on steroids, period. You can always put him on something else, like maybe a long-acting beta agonist. So that was that. So she wrote down that yeah, only if there are if they have severe problems, to call the pulmonologist. So that's kind of how my screening day in the COVID triage was today. I was expecting to see more patients. I guess this was my second time in the screening. I actually saw one more patient. So, I guess it is more than what it was about a week and a half ago, uh, 2 weeks ago. So, was that only last week? Oh, no, it was only, I think it was only last week. Yeah, time. I can't. I'm getting confused with time. It seems like it's been months since we've had this. Uh, you know, um, uh, and it seems like it's almost years that we've been fighting this COVID, or at least trying to stay ahead of the COVID. So, so yeah, so that's how my day was in the COVID screening. Those are the only changes. Oh yeah, the other thing is that so there was another policy or another email that circled around the provider saying that when you're ordering this, order the COVID panel, not the COVID screen, because I guess one just goes to another facility and one goes to another, and then there was mention of you can order COVID screen without calling infectious disease, unless you get a case where it's like kind of iffy. But if it's like this person, has exposure and has got symptoms, go ahead and order it, and you don't need to get ID approval. Um, but if it's questionable, go ahead and call them, and they will give you guidance. And so then the question, and then somebody threw a question and said, "Hey, were you at the meeting with infectious disease where we're going to be testing more and more people?" And I guess somebody was asking, well, how many test kits do we have anyway? I said, I emailed back. I said, well, I was there this morning, and I think I have six. I said, I think we have six left. And uh, and then the doctor who replaced me said, "Nah," she says, "I just counted them." And she says, "I there's nine." And they were going, "Oh wow, that's not a lot." Then somebody else wrote, "Well, on this team there are nine, and then this team there were 10 last night, and then I don't know, how many are in this team, blah blah blah." I said, so I replied back, said, "Oops," I said, "Sorry, I miscounted, and I I said I didn't count right." So then I went to the other another team, but before I did that, I when I wrote that apologetic email, and I said, "Oops, I miscounted," and I said, "Well, can't we use the one in women's health for like the ones that they use when they're testing for chlamydia?" And so so the doctor who works women's health said, she said, the guy from employee health uh, got 40 of them. She says, we could probably spare another 10, but we want to leave some here for, for patients who might have cancer, blah blah blah. So so it's like, so there was like a big, oh, that's not a lot. So then somebody wrote, well, are we supposed to be testing everyone, or is that for just the inpatient? So in the meantime, I went to the other team where there was an account, that didn't have a tally. I went there and I was talking to one of the nurses, and I said, "Hey, do you guys have these swabs?" And so she takes me to the I said, Does infectious disease," because they have clinic right next door to my office, and I said, don't they I said, "Don't they do swabs here?" And she says, "Yeah." She says, "What do you mean?" She says, "Let me this." So she took, she was kind of like puzzled, right? So she took me to the infectious disease where they actually sit around and actually do their where it's the doctor's room where the residents and fellows present. So we found a whole box. We found a whole box. There must have been at least 50 or 75 swabs. And so I took a picture of that, and I sent it by email to one of the doctors. So sort of like kind of like taking a co-lead since our medical director has retired. And she says, "Wow," she says that's a lot. So yeah, and then the co-medical director found me and says, "Oh," she says, "I heard you found a gold mine." I said, "Yeah." So now we have tons of kits. I think if we really needed to, we could probably do over 100 swabs in a day. But like I said, I only did one swab, and I don't think they did anything in the afternoon. I think a lot of them are going to our main hospital where there are two tents and where they do more screening. And by the way, the patient that came back to our clinic after going to the hospital, it turns out that it's not that they didn't want to do it. The patient, did not want to go to another tent to get the test. She was expecting to get it right there and there where they asked the questions, which is just not that way. So she didn't want to walk around. She didn't want to get out of the car. So that's why, and it worked out fine. So yeah, so she got tested, and like I said, supposedly it's gonna get worse, but we'll see. And they're saying that it's actually gotten worse in LA. More admits. But yeah, so I think there have been 162 deaths in LA County alone. Hopefully this doesn't get any worse, but we've been planning for the worst. Um, I think we have some equipment. Uh, it's the just the we're thinking that this is the calm before the storm. So uh, let's just hope that let's just hope it stays this way for everybody's welfare. So I still have a smile on my face. It's the day two. So I hope I keep my smile on my face. And, I wish you guys good health and be safe. So I'm going to end it right here. So I should give you an update. My student uh, from UCLA should be coming in to see me to be with me tomorrow. I don't know why. I'm not really doing much. Oh, actually, I am. I'm actually covering for another provider who's gone on vacation in the middle of all this. So yeah. So I'll tell you a little bit more tomorrow. And like I said, have a good night and take care and be safe. We'll talk again tomorrow. Good night. Oh, please remember to subscribe. Thanks. Bye.